The Mental Health Association will be opening 2 new residential programs in the region that focus on substance abuse and mental health. The program is called GRIT. One will open in the city of Springfield and the other in Holyoke. I spoke with Christine Palmieri, the Vice President of Recovery and Housing Services at MHA, to learn more.
It's been a very interesting experience. I think initially we all, like the rest of the world, kind of reacted and tried to figure out the best way to move forward. Our services never stopped. We didn't really slow down. We just had to think differently about the way to provide good and safe care to the people that we support in the community. So we had to make some adjustments, and we had to do a lot of things remotely, as we're doing now. But like I said, the work continued. We continued to provide support and make sure that the people that we support were safe, had access to the services that they needed, despite the fact that we couldn't really do a lot of face-to-face.
So tell me a little bit about the launch of the 2 new GRIT programs. And I know part of your job is housing. Talk a little bit about this service that's going to be offered.
Sure. So we have one residential recovery program that's been operating for about a year that serves individuals who experience both a mental health condition and are in early recovery from addiction. And we are excited to be opening 2 more programs in the next several weeks. One residential program is going to serve 16 young men who are aged 18 to 24. And the other is going to serve 16 adults who identify as LGBTQ+.
And where will those residential homes be located?
Yep, the program for young men is in Springfield, and the program for LGBTQ+ adults is in Holyoke.
Can you describe a little bit about the GRIT program? Because you talked about both mental health issues as well as substance abuse, and how the program kind of addresses both in a residential setting.
Sure. So we believe very much that it's important to address both mental health conditions and addiction at the same time. Traditionally, services have been really provided toward one or the other. And we really believe in a kind of an integrated model of supporting people who are experiencing both conditions. So we have clinicians who are trained both in mental health and also in addiction. And all of our support services and all of our training and all of the groups that we provide are really geared toward a recognition of both conditions and how they interact with each other. So we offer groups that are related to coping, and it's coping both with maybe symptoms of depression, but also how to experience symptoms of depression without using alcohol or other drugs. So it's a really an integrated way to provide services to give support to individuals who are experiencing both conditions by the same team in the same house.
How did you manage that for the first program that was opened about a year ago during COVID? Was it a lot of remote sort of counseling? And did they remain in the home as well?
Yeah, it's a little bit of both, right? We can't provide residents 24-hour residential programs, so we can't provide the face-to-face care remotely. We had staff in the programs 24/7, 365. They are a dedicated and amazing group of individuals who really put the health and the safety of the residents above all else. So services continued. We didn't stop. We thought a little bit differently about the number of people that were coming into the program every day. And we thought about how to make sure that our staff were protected and that our residents were protected. Everybody had PPE, and we tried to manage social distancing as much as you can in a house that serves 14 people. So we did think differently about the way that we provided services. When possible, we did things remotely, but the 24-hour care was still provided in person by our amazing staff team.
And how long does the program last for people?
It's really up to whatever each individual needs. It's not a time-limited service. So we've had individuals who have come and successfully completed the program in several months. And then we've had others who are still at the program after a year. The biggest barrier to having somebody graduate is actually trying to find them a place to live after they leave. And that definitely was, our ability to do that swiftly was affected by COVID and trying to find people safe places to live and apartments to move to. But things are settling down a little bit here. And so we're having, more people move out and more people move in.
Tell me a little bit about just the fact that we had COVID-19 and there's so much isolation. How has this affected people who are struggling not only with mental health issues, but also substance abuse? I can't imagine that the isolation is something that's helpful.
Absolutely. Isolation is very challenging for all of us, whether you experience a mental health condition or addiction or not. And so it's even more difficult for somebody who's struggling. So I think, like most providers, we tried to do as much as we could remotely. We kept connection with everybody that we served in this program and across our continuum by phone, as we are doing now via telehealth. And, we also did face-to-face visits, just, practicing social distancing and wearing PPE, because isolation is absolutely a trigger for many people, for many things. So, we recognize that now is the time to provide additional support and not less support. So, we just had to think more creatively about how to do that in a way that was safe.
And that's a big challenge for everybody. You still need that additional support, but making sure that you can do it safely. Tell me a little bit about a typical day of a resident.
Sure. So it's a long day. Folks get up early, and we start every day with kind of a check-in about what everybody's plans are for the day, what they hope to accomplish. Everybody's working on different things. So some people might be trying to get housing, and some people might be trying to get a job, and some people might just be trying to figure out how to cope in a different way. So we have groups throughout the day. There's 3 or 4 groups every day, individual meetings with therapists and clinicians that we have embedded in the program, individual meetings with individuals who prescribe medication. We also have care coordinators who work with every individual on kind of an aftercare plan or a discharge plan, so that we're setting people up to be successful when they leave. So it's a really full day of groups and conversations and making sure that individuals have the skills that they need in order to be successful in the community.
And can you tell me any of those success stories? Because I know for families who are struggling with this, recovery is lifelong. That grip of substance use, can seem impossible to loosen. And, is there anything that you could share that could give people hope who are right in the thick of it?
Absolutely. I mean, we've worked with a lot of people who are successful. It's a struggle. It's not an easy road. I mean, we call the program GRIT because that's what it takes, really to be successful on this lifelong journey. But we've worked with many individuals who have come through our program and learned some skills in order to think about the way that they cope differently. And people have left our programs and are living independently and working jobs and have, get back to connections with their families. So it absolutely is possible. It's not easy, but it is absolutely possible.
And when does the program begin? When do you move people in?
Right. So we are, the program for young adults, we're hoping is going to open, hopefully in August. We'll be able to, probably the later end of August, start moving people in, and then September for the LGBTQ program.
And people just apply, they reach out to MHA and say, I'm interested in this. There must be some sort of process? Absolutely.
So anybody who's interested, or even if you have questions, 1-844-MHA-WELL is the phone number for our central intake person, and she can answer questions about the program. She can start the intake or referral process and get people connected to the program that's right for them.